Chief Meteorologist Dan Threlkeld has been in the hospital for a little more than a month now. He's suffering from Guillain-Barré syndrome. So what exactly is that? 2 News anchor Russ McCaskey visits with a doctor to find out more about what Dan's been going through in tonight's To the Point.
We're with Dr. Jim Harjo. Thanks for being with us today.
Yeah, I'm glad to.
Let's talk a little bit about Guillain-Barré syndrome, because obviously our chief meteorologist, Dan Threlkeld, has been in the hospital for a month dealing with this, and a lot of people are kind of curious exactly what is Guillain-Barré syndrome.
Sure. Well, you know, it is actually it's a neurological disease, but it's a little unique in that it's a neurological disease of the peripheral nerves, but it's also an autoimmune disease. In other words, the body's immune system is now attacking the nerves. And, you know, it happens pretty quick. You know, it lasts up to 4 weeks, at least the acute part. But, you know, in short, you know, it's a neurological autoimmune disease, you could say.
And, you know, Dan had a respiratory infection, and then he had his gallbladder out, and that's kind of when it manifested itself. I guess any of those kinds of things could bring it on?
Right. Any kind of viral or bacterial infection, you know, there's a propensity, there's a certain bacteria and a certain virus that they've looked at over the years that could, you know, you could have more of a chance to get Guillain-Barré. But usually it starts with an infection like that, and really the immune system is still pretty hot and, you know, wanting to clear this disease, this infection, and it recognizes certain molecules that were on the bacteria or the virus on the myelin sheaths of the nerves, okay, and even on the axon in certain subtypes, and it's still pretty hot. It's kind of like an army that's fighting, and it's still looking for a target, and it starts to attack the nerves, and of course that's when you start to see the really aggressive, progressive neurological symptoms.
Right. And he said that he's just had extreme numbness in his hands and in his feet. So he's obviously been doing a lot of occupational therapy, speech therapy, physical therapy. And I guess that's just the treatment. It just kind of has to run its course, and it takes a while?
Yeah, it is. There are other treatments that are available if needed. Now, whether they're needed or not kind of depends on how that patient does. If they get to the point where they're not able to walk and it's really progressing, they can have an exchange of plasma, or they can actually have an infusion of IgG, which is antibodies. This is believed to displace those antibodies and even reduce the load of those antibodies so that they're not attacking those nerves as much. If someone seems to be doing fairly well, then those treatments can be held and just do watchful waiting, you know, symptom management, support, and see how they do. And then ultimately they will need physical therapy. You know, it takes a while.
But I guess the good news is it seems that everyone makes a full recovery from it. It just takes some time.
Yeah, it does. About 85% and even a little more than that will fully recover. Now, it depends on which type you have. There's 6 different subtypes. But 85% of the people that have the most common form, they'll make a full recovery. You know, it kind of depends on the person in a few months, or it could take as long as a year.
Yeah. Are there any other complications that arise from it, or is it just once this is over with, then that's the deal?
Yeah, there are complications, and really they can arise from just being in the hospital, lying flat. You can get a blood clot. You know, you can get a blood clot that goes to the lung. You can have deconditioning in the muscles. Just they can shrink, and you could feel weak. That's a lot of times that's why you really need the physical therapy as well. Anyone that's in the hospital, anyone that is sick, other things can emerge. You can get a pneumonia, or like in Dan's case, he picked up a Bell's palsy. That's not a common thing you have. But anytime you have a disease or sickness, the immune system is very busy. It's very busy, and so there can always be an opportunistic infection that can occur as well.
Obviously, it's something to be taken very, very seriously. Does catching it early help, or? It
does. In fact, you know, it's really hard to catch early, though, because you're not, you know, like with any disease, you're not sure what it is early on. You know, take appendicitis. If someone just has a little bellyache, they thought maybe they ate something bad. And so the trick is to catch it early and institute treatment if needed, supportive care. I mean, ultimately that's the best thing, but it's really hard to tell when do you tell that this is Guillain-Barré, because it's pretty rare.
Right. Well, thanks for joining us. Thanks for all the information about it. And obviously we've had a lot of people writing cards, sending letters, telling us that they've been thinking and praying for Dan. He certainly appreciates all that. And we're going to continue to take those cards and letters to him up to the hospital. So drop them by the station and we'll get them to Dan. That'll do it for us.
Dr. Jim Harjo tonight with Russ McCaskey. Good news. Dan actually may be getting out of the hospital within the next week. He says he could be back on the air in about a month. We will certainly keep you updated on his progress during our newscast, but you can also find an entire section of our website dedicated to Dan at KJRH.com.